Presentation for XNB 382, Principles of Exercise Prescription. The subject of today's presentation is X, a 23-year-old male. In recent consultation, X revealed that he desired to improve his cardiovascular endurance, develop his power, speed and agility, and improve his regularity around training. These goals were with the end of improving in his chosen sport of rugby at the number 8 position. Today, using the results of recently taken pre-screening tests and health assessments, we will take a closer look at the requirements of the number 8 rugby position, how X's goals correlate with these requirements, and what is inhibiting him from arriving at this end. The test revealed that X has a low CHD risk. He had no known signs of cardiovascular, pulmonary or metabolic disease or any risk factors. His physical characteristic measurements were as follows. Weight, 89.8 kilograms, height, 179.4 centimeters, body mass index, 28, systolic blood pressure, 122 millimeters of mercury, and diastolic blood pressure, 75 millimeters of mercury, both of which are in the ideal blood pressure range. He has no excessive physical limitations, excluding a right wrist injury and a previously injured right Achilles. The ESSA exercise pre-screening tool revealed no underlying health risk to X partaking in an exercise intervention. The Journal of Science and Medicine in Sport found this tool to be effective in filtering individuals with contraindications to exercise. The PAR-Q questionnaire revealed no underlying health risk to exercise. The Fantastic Lifestyle checklist scored him at 74, which gives him a rating of very good. He has no immediate or family history or current symptoms of cardiovascular disease, does not have asthma, doesn't suffer from diabetes, and does not smoke. He therefore has no contraindications to improving his cardiovascular endurance. His BMI currently sits 3 points over a healthy weight. However, the findings of King et al. Say that a high body mass index is no barrier to the participation of physical activity in both elite and recreational populations. It must also be noted that BMI does not take into account muscle mass or bone mineral density. His current physical activity consists of 3 bouts of moderate physical activity at 60 minutes each per week, which does not meet the current physical activity guidelines. One of the consultation goals was based around this issue. When prescribing exercise to X, what must be considered are the demands of the sport he wishes to participate in and his personal health inhibitors, preventing him from partaking in physical activity. A study conducted by Cunningham et al. Found that players in the back row covered considerable distance in a full game scenario. The same study revealed that players in the back row and the rest of the back line needed high levels of power and speed to play the positions effectively. Thus far, the requirements of the position fit well with the goals set out by X. However, joint injuries can impede resistance training progress and place affected joints at a great stress of the injury worsening. This makes the aim of X's resistance-based exercise program the following: to develop the aforementioned requirements of a number 8 rugby player while avoiding the re-injury of the wrist and right Achilles. A study found that the best way to improve wrist injury pain outside of a clinical setting is to introduce wrist extensor strengthening exercises. The study stated that although clinically supervised exercise may be better for wrist pain, extensor strengthening can reduce pain, and as X has not complained about severe pain, he would prefer to carry out his rehabilitation exercise at home. In terms of X's Achilles, Gahid Kudson et al. Stated that re-injury is at a high risk when athletes return to sport early. He has been cleared to participate in exercise, so long as he doesn't report pain, he should be in a fit state to participate in physical activity. The formulation of these needs are based on X's current health detriments and the requirements of the position in his chosen activity. Acknowledging these needs fit with the goals X presented in his initial consultation. This, however, may not always be the case, and future practice should be mindful to ensure that the subject's goals are consistent with his pursuits. He has no cardiac inhibitors and a wrist injury and previously injured Achilles that contraindicate exercise performance. With these inhibitors in mind, a program can be formulated that will help X work around his wrist injury, increase his physical activity to the recommended amount, and attain his goals.